It's Mari McInerney from Craigie here at the Advanced Pharmacy Australia's National Conference in Adelaide, and I'm speaking here with who I'm told is pharmacy royalty, Professor Sanson. Could you introduce yourself, please?
Thank you, and thank you for the opportunity. I'm a pharmacist. I graduated many years ago and had the privilege of serving the government on the Pharmaceutical Benefits Advisory Committee for many years and acting as advisor to the department. Very proud pharmacist.
Thank you. You talked today about medication shortages. Can I suggest that your overall message was we've always had them, we'll always have them, some are worse than others, but things are going to get maybe a bit tricky?
I think that's true. I think, shortages are a part of the supply chain. I mean, no matter whether it's pharmaceuticals or anything else, there's often times when the supply chain doesn't function properly, and that's true for pharmaceuticals. I think there's always has been shortages. I cannot see the future where there's not going to be some shortages. We just have to be more strategic in the way in which we be proactive in looking at policies that will identify shortages earlier, make our response better, and then be reactive, what we do to minimise the impact of a shortage. And that requires a health policy development, which I think I'd like to see in this country as being more of a national approach for the management at the grassroots of drug shortages.
And you talked about that because it creates competition but also repetition, yes? Can you talk about what the problem is with not having a national approach?
Not having a
national approach?
Well, I think it means that there's a lot of time and effort being spent by individuals, which often I think is duplicated. And so one of the issues that has been clearly identified in Australia and internationally is the impact of shortages on pharmacists, that they are spending time dealing with shortages rather than dealing with patient care. All right? Now, as I said, it's always pharmaceutical logistics is an important part, but it is a situation where a national approach allows a better coordination. We can use, clinical expertise. It's not necessarily has to be binding, but instead of having 50 hospitals coming up with 50 different options how to deal with a shortage of a particular agent, there's a collective, we've got institutions like the Safety and Quality Commission in healthcare who are capable of doing those types of issues, and I think I'd feel more comfortable if there was a national rather than a local approach.
And is there an example you could give of a recent shortage where we really needed to do that for the broader health service sector to understand?
Well, I think one of the issues that was raised by one of the people today was the shortage of heparin. I mean, if you don't have heparin, what other alternatives do we have? And if those alternatives are in short supply, how do we manage that? And that's, we can have the situation where I'm all right, I will hoard some of this for me. But it needs to be a wider national approach, I think.
Now, you're suggesting it would be great to have a national approach in sourcing and stockpiling and those sort of things, but you also called on the government to take more of an international perspective on shortages, yeah?
Well, I think the issue is that there's now such a concentration of manufacturing institutions in a limited number of countries. So most countries of the world today are highly reliant on India and China to produce the raw materials and to produce the drug products of many drugs that we use. And so it becomes geopolitical. I mean, it's no different than if we were selling any other commodity. It's simply that we've got to make sure that our trade partners, for who can supply us with pharmaceuticals, is locked up in trade agreements. All right, and I said we do it for other issues, wine, lobsters, as I mentioned. I'd love to be able to see an overtness with respect to the way in which trade agreements are going to be important. What we've seen in the recent months is the European Union forming a consortium that will now act as a reservoir for drug shortages. And now we've got change of government in the US where trade wars, or call them trade exchanges, are going to be different than it has been in the last 4 or 5 years. What impact that will have on shortages outside the US and outside those countries that are producing it is yet to be determined. But it's something we should be thinking very seriously about, and not being caught up in trade wars where pharmaceuticals become part of the war.
And do you have a suggestion about how to go about that?
Oh no, I think being overt. I mean, I would hope that the Trade Minister has raised this issue. But I've said I've read about wine and lobsters. I haven't heard about pharmaceuticals. Now, maybe they have been, and I hope they are.
And that's part of what you said, that the idea of the US now under Trump putting a 60% tariff on Chinese goods. The verdict's out on whether that for Australia is a threat or an opportunity, yeah?
Well, I mean, the answer is I don't know. Nor does anyone, I don't think, at the moment. But, the United States imports 80% of its raw materials from China, and they're going to put a 60%, which means the cost of goods in the US is going to go up. All right? Now, what the impact that will have on this country, will China be happier to sell drugs to Australia rather than the US? The answer is no one knows at the moment, but it should be on our radar. That's the point I'm making.
And if I can ask you to predict a bit more, post-COVID, have we learnt a lot about medication supply and demand? Will we manage another pandemic better?
I think we will. Certainly, I mean, the government's contribution to Moderna for the large mRNA facility in Melbourne is, I think, a sign that the government is investing. But it's made the decision to invest in a certain technology, which is mRNA vaccines. All right. Now, could it do it across the board? Well, I think the government has made a decision to say that the mRNA technology offers a very, very good buffer against pandemics, because we can switch on and off quickly. We'll invest in that as a manufacturing facility. Should they do all things? The answer is yes, government should always do all things, but they can't. And so I'm certainly not opposed to the government supporting local industry. But my point of the lecture was that it's very difficult for us to become completely self-sufficient in every medicine. It's just not feasible. It's not practical. It's just not going to happen. And the impact, of course, is that, remembering most of the products that we import from overseas is in countries with lower wage structure, lower cost structures. So if we do it in Australia, we're going to have to pay more. And then the health budget gets affected. And then how does that increase the health budget affects access to healthcare? It's not a simple solution.
You talked about an interesting driver of shortages that I hadn't thought about, social media. Can you talk about that? That was in relation to ADHD medication, yeah?
Well, no, it was in relationship to Ozempic, the drugs which are used for diabetes, initially for diabetes, but now also being used widely, very, very widely, for obesity. That was a situation where the drug was registered in Australia for diabetes. It was not registered in Australia for weight loss. It is now, but it wasn't then when it was. And so the social media just determined that everyone wanted weight loss, which is fantastic. I mean, obesity is one of the biggest drivers of poor health internationally, including this country. But it was fascinating because the demand was just much greater than our expectation. We didn't think that this would take off the way it has. Now, so there was a shortage, and then we had to make a decision who to give it to people with diabetes or the people with obesity. Well, you know, they're not mutually exclusive. People who are obese get diabetes, and so and the poor old pharmacists were just caught in the middle of this, and what it did was put patient against patient, and it just is an example of social media. So the point I was making is that we use horizon scanning to look into the future. We should do that not just in terms of new drugs that are coming, but in terms of treatment paradigms that are changing and how they might, and what we call drug repurposing today is where an old drug is used for a new purpose. We've got to predict that. We've got to be, you know, at the coalface, if you know what I mean. It's like there's a trend that this drug is being used increasingly in this population, which is much broader than what it's being used now. So there was no shortage if we kept it for its old indication, but its new indication is going to be much bigger. Are we prepared for that? Have we discussed that with the manufacturers? Are they aware of it?
Who should hold those discussions?
Who? Oh, I think the government. I think that's the department is, and I think they've done pretty well. As I said, the government I think reacted and responded quite well to the shortage of things. I think we could have been in a lot worse situation if they hadn't done some of the programs that they've done to address the issues. But as I said, my message I think is that we should take a more broader national approach to some of these issues rather than allowing the individual health units to sort it out at a local level. And people will argue, well, people who sort it out at local levels have local ownership and therefore, that they can deal with it better. No, I understand and I accept that, but I don't think the two are mutually exclusive from one another. The national leadership and the local support, I think, is just a continuum for me. But without, you need both to get that continuum.
Now, if I could ask one more question, you've retired now. Any reflections on your career? What have been the big moments? What are you looking for?
It's been a buzz. I've enjoyed every minute of it, and I miss it. It's just been a privilege. I've been very, very lucky to have served on positions. We developed the National Medicines Policy in the 90s. That was, taking a multidisciplinary group together and coming up with a National Medicines Policy. That was a buzz. To chair the PBAC was just such a privilege and an honour. And so I've enjoyed every minute of it.
Fantastic. Thank you for your time today.